Hello, everybody. It is Renee, and I am here from Reformation Wellness in Los Gatos, California. And today I am sharing a subject that I think is so important, particularly, well, for both ladies and men. But I know we're going to be talking mostly about ladies today and some hormone replacement therapy. And I would like to introduce my friend and a clinic coach, Mendy Peterson. And she is from Nebraska and Omaha, right, Mendy?
That's correct. That's correct.
Okay. So she is a PA there, and she does quite a few things in addition to running the Ideal Protein Clinic there. And so, Mendy, say hi and tell us about yourself.
Thank you so much for having me, Renee. I am speaking about something that I'm super passionate about. I know many of your clients are weight loss clients or lifestyle living clients, and we feel that this is a huge portion of weight loss. It's actually been shown to be about 25% of all weight loss. So if you haven't had your hormones checked, I would definitely encourage that. This is just one option out of many, so I want patients to feel comfortable with it. It's been around forever, and I'm super excited to talk about it. We've been doing hormone replacement here in our clinic for about 3 years, and I've been doing hormone replacement for about 20 in my practice. So thank you for having me, Renee. I appreciate it.
Yeah, absolutely. And so if you're just logging on, first of all, do us a favor and share this broadcast. This is such great information, whether you're losing weight or just trying to maintain your weight or wondering why you feel funny. All of these things happen, and they can happen at various points in life. So I know that for me personally, probably around the age of 48 years old, I remember that kind of one of my markers was someone didn't invite me to something, and I started crying. And my boyfriend looked at me and he was like, "What is wrong with you? You need to go to the doctor." So, some of the things, tell us some of the markers for when we are maybe ready to get our hormones checked. I know emotions is one of them.
Absolutely. So a lot of times patients come in, they can be anywhere from usually 30 years old to 80 years old, honestly. And they just say that their energy is low, they're having trouble concentrating, they can't lose the weight, their waistline keeps expanding, they're on ideal protein and they're just kind of at a stall at that 50-pound mark. And they're just looking to decrease that visceral fat that we're so prone to and reduce the risk of heart disease. So honestly, the typical patient comes in a little bit later, but studies are showing that if we can catch them early, then they do much better. So if you can look at that 29-year-old patient at age 30, they're going to lose about 1% of their hormones per year. So it's really important to get a good baseline as well. So even if your hormones are in check, get that baseline so that way we know where you're at, because it fluctuates so much. So your doctor might be telling you your hormone levels are normal, but then you may not have a normal for you to actually compare. So it's always a great idea to get hormones checked even when you're feeling well.
I love that idea too, because the whole goal with the bioidentical hormone therapy is to kind of turn back time. Is that right? To kind of
Absolutely.
to balance us to when we felt our best, maybe like 35-ish.
Yeah, we think of it as a vitamin, right? So we can function without vitamins, but when we have them, we feel so much better. So if you forget your ideal protein vitamins, how do you feel? You feel off, and your coach says, "Oh my gosh, I noticed that you've been out of your potassium for a couple months. No wonder you don't feel well." So same thing with hormones. Patients ask, how do I know when I need hormones? Well, when we replace them, then they definitely know that they feel better. So it's an individualized approach, and so hopefully everybody has a provider that they feel super comfortable with, because it can be a real sensitive topic as well.
Yeah, absolutely. So I know we have a bunch of people on here, and hi to everybody. I see your comments coming through. Do us a favor. If you have questions for this broadcast, please put them in the comments section and we will be answering lots of different questions. So there's no one time that you know, just start, you know, feeling this stuff, and it's different for every single person. But Mendy, would you kind of give us like a quick synopsis of what the bioidentical hormone therapy means? Because I know, you know, there's a lot of people that are confused with HRT, which, you know, had problems causing breast cancer, but that how this bioidentical hormone therapy is so good for you and creates better health.
Absolutely. And that's a great point about, we used to actually stop hormone replacement therapy after 5 years of use because of the breast cancer risk. And we now know that it's actually protective. They did a study on patients. They took 2,000 clients and all with breast cancer. And they chose to have 1,000 of those breast cancer patients not have any hormone replacement, and then another 1,000 having hormone replacement. And they actually lived longer and had less morbidity and less problems and less breast cancer reoccurrence. So if you'd like the article, I'd be happy to share that with you. So if your doctor's not sure and they tell you that, hey, I don't believe in this, then definitely question them, question the studies, be well informed. So we've been doing this since the 1930s. It started in Australia and Europe, and it was brought to United States in the 70s when we started getting compound pharmacies. So when you're talking about hormone replacement, you can actually get hormone replacement through a pharmaceutical company, through a compounding company, or through naturals. Okay. So there's a difference between natural hormones, which would be plant-based, food-based, right? So we can get our hormones of testosterone and estrogen through foods, through our ideal protein foods. Now, the ideal protein foods are washed, so you're not going to be getting any active proteins or hormones, but you're going to be getting it through your vegetables, okay, and your whole grains if you're on the alternative program. So when we talk about pellets and we talk about bioidentical, you're getting them from a compounding pharmacy, and they're actually made out of yams. And the pellets are actually inserted in the hip if you're going to go with a bioidentical hormone. Okay, if you're going to go with a prescription strength formula that you're going to get from the pharmacy, you're probably going to get it in a pill form or in a cream form. Okay, but with the compounding pharmacy, don't let there's a myth that is not FDA regulated. It absolutely is FDA regulated. They come to the facility that we use in Irving, Texas quite often, and there's standards that they have to meet as well. So a compounding pharmacy is just as regulated as your regular pharmacy that you get your Zoloft or thyroid medication from. So we've been doing this since the 1930s. It really picked up in the 1970s, and now you're seeing retail clinics all over the place. We have a place here called New Male Medical, or rejuvenation clinics and all of that. So pick a reputable provider. Pick a doctor if you can, or a DO, or plastic surgeon office if you can. They're board certified and that they get reputable pellets from these companies, because they're numerous and that can be really confusing. So definitely ask lots of questions, get some second opinions. Don't be talked into any long-term contracts. We don't believe in that here. Pick one and go with one, and maybe get a couple rounds and then see how you feel. So not all pellets are created equal. Not all doctors are created equal, right? So pick one that you feel super comfortable with. Okay.
Yeah, for sure. So what is the testing process that happens before you determine like the certain amounts that each person is going to have of the different hormones? What type of test can someone expect?
We typically recommend for males to have a PSA test and a prostate exam, which is super important because when you give testosterone, it can actually swell tissue. So you don't want your PSA to rise. If your PSA does rise, that means you have a problem. It's probably a pre-existing problem. In females, we want you to make sure that you have your mammogram and that your mammogram's current. So those are the most important. Other labs that we look at are thyroid testing. We look at your CBC BioTE. It can actually raise your red blood cell count. So you want to make sure that your hemoglobin doesn't get too high. And there's ways that we can mitigate around that, which we'll talk about later when we talk about side effects of pellets or hormone replacement therapy. And then we always want to make sure that we look at your FSH, your estrogen level, and your testosterone level. There is a free testosterone level, not quite as important as regular testosterone, but those are the standard labs that we typically do. And then we'll repeat those labs at about 6 weeks to make sure that your levels are optimal, and then we can change your dose from there.
All right. Wow. Very good. Okay. So do you want me to play the first video?
That'd be great.
Okay, so Mendy is going to share some informative.
And Renee, I can't see a video, so I'm not sure if we need to switch back. Oh, there you are. It's coming. And I'm not sure if we have any sound on the video. So hopefully we have sound. I'm not sure.
Oh, bummer. So there was no sound on that. The sound didn't come through.
Yeah.
Oh,
it didn't come
no.
through on my end, but that's okay. That's all right.
Okay. Well,
I have a backup here.
You have.
No worries. I can be the video. It's okay. So you got to see it, and that's the BioTE Medical. That's the company that we use. Okay, so you can actually get pellets through lots of different companies. And in the video, you saw the pellet is actually this big, and it's inserted in the hip. Okay. For females, every 3 to 5 months. For males, every 6 months. Okay, so the males are going to get a lot more pellets than the females. The male dose is going to be much higher. Okay. And why do we do this, right? You saw in the video that they talked about low energy level, moodiness. They talked about, sexual dysfunction. So those are all reasons that we may want to have hormone replacement therapy. Okay. But really the 3 main reasons that we want to do hormone replacement therapy from my end of things, we call those things the icing on the cake, right? But really, we want to increase bone health. It's about 8% better than any osteoporosis medication that you can get on the market, okay? The second reason is for dementia prevention. We know that the brain functions better and that patients have less dementia and over the long run. And these have been time and time again, reproduced in medical studies. And number 3, cardiovascular health. So you have lower lipid levels as well as low blood pressure levels. So I'm just going to kind of show this graph if you want to zoom in on this, Renee. And this talks about cholesterol levels and what it does over time. And you can see that it can take quite some time to actually get better cholesterol levels. This graph actually just shows the actual effect, and we can actually see maximum onset at about 24 months. Okay, thank you so much. Appreciate that. And we also see those correlations in blood pressure as well. Were you able to see that okay, Renee?
Yeah, that turned out great. For all of you that are online with us today, this is a great opportunity. If you have questions about your hormones or about symptoms you have, please feel free to send your questions in the comments and we will answer them. So there's no one specific time at which you decide, you're going to jump on board and try different things. But, one thing I really, really encourage my clients to do is, you don't have to feel bad because you're getting older. You don't have to gain weight around your middle because you're getting older. And I'm not going to tell you that it's not a struggle, because I'm 56 and I started really kind of going into probably perimenopause about 48. So I've been on bioidentical hormones now for about 8 years. What a difference it makes. But still, you're always having to be on top of things. And if you're not feeling quite right, you get in and you get tested and you figure out, the different levels and how they change. And maybe you can speak on that a little bit, Mendy, as to how to monitor yourself and how to understand when you need to get in and maybe, change things out.
Absolutely. And there's actually a quiz on our website, biotmedical.com, that you can take to actually know your symptoms. So low libido, erectile dysfunction, those are all very common symptoms that patients have, especially vaginal dryness. And you may even want to start out with a cream at first if you're not so sure that you want to do pellet therapy for your bioidentical hormones. This is a brand new one. Our rep actually came by today. And I just love the name. So it's called Imvexi, and there we go. Thank you. And you actually insert this vaginally, so only for the females, but super helpful because if you are having some of the symptoms, but you're not sure that you want to jump on board, this is definitely a great option. So, yeah, so and you may not even notice that you're having symptoms until you get the pellets and then you feel much better. So, definitely start with those levels first with just a simple lab test. And then it's important to know that the lab test is not actually going to tell you, oh, you need the pellet or you don't, right? Because there's going to be lots of people that are candidates. So there's no one level that's going to tell you. So irregardless of the labs, it's important that you maybe try it if you're having symptoms. We try not to treat the lab, right? We try and treat the person and their symptoms. So, even our lab will tell us that hormone levels, and I just want to show you one more graphic here. Optimization for males, our lab tells us, I'm going to try and get that in your window here. Our lab tells us that hormone levels are actually optimized up here. So up at the 1100 mark for males. And your lab, thank you. And your lab will actually tell you that normal is 300. Okay. Thank you, Renee. Appreciate that close up there. So definitely pay attention to how you feel, and don't let anybody tell you that, oh, you don't need it, or but definitely investigate all avenues and have your primary care provider refer you if needed. Does that help answer that question, Renee?
Yeah, and I think, I want to not only, I know we're talking about bioidentical hormones today, but honestly, I think the biggest thing I see in my clinic is people that I know need thyroid, help, whether it's up or down, and your doctor is consistently telling you that you're in the normal range. And what Mendy just showed you is so indicative of Western medicine. And that's why, going to a functional medicine doctor, going to a practitioner like Mendy that specializes in these specific therapies is so important to advocate for yourself. So when you're not feeling your best, it's not natural to feel exhausted 24 hours a day. And when you're feeling like that, get to the bottom of the problem, right?
Absolutely, absolutely. And it's important to remember that if this isn't something for you, that there are natural ways to feel better too. So one thing that I wanted to mention, especially for ideal protein candidates, is that you can get estrogen and testosterone from foods too. So our estrogen foods, flaxseed is really good, vegetables, tea So I know a lot of people don't realize that, but tea actually is a huge estrogen booster. Grains, pasta, and coffee. Testosterone foods that are really helpful for the males, and you know, females need testosterone too. We don't realize that, but we do need testosterone, especially to balance the estrogen. Beef is very high in testosterone. Garlic, eggs, broccoli, and oysters. So if you're, you know, having trouble, or if you know, hormone replacement isn't for you, it's really important to look at foods as a source of hormones as well. Herbals for testosterone, there's actually a flower, and I'm going to struggle pronouncing it, but it's called Tribulus terrestrius is what that's called. And I can write that down for everybody if you're curious, but you will find that in some of the herbal homeopathic stores around town.
All right. So do you want me to play that that one with the pellet video, and then you can just talk about it?
Yeah. Does my sound come through when it's playing?
Your sound comes through when it's
playing. Yeah, absolutely.
So
walk us through it. So
all right,
let's walk us through a typical pellet.
Get that up here, and I'm gonna take me down, and then you won't hear me.
Okay. So what we're about to watch is a typical pellet insertion. And so when we bring patients in, this is going to go into the hip, okay? We can do it into the stomach area if we need to. And so sometimes there's a risk of that pellet extruding. And so you want to really follow your doctor's advice and lay low for at least 3 to 7 days afterwards, okay? So this is an actual physician inserting. So right now what she's doing is she's numbing up the area. Okay, we're going to just make a wheel underneath the skin. And now she's putting the pellets in the trocar. And this takes, again, just a couple minutes. We make sure that everything is sterile. We make sure that, you know, we're using, you know, supplies that are very clean. And you want to make sure that you leave that Band-Aid on for about 3 to 7 days afterwards, a little bit longer for males. But you can see we just do steri strips over the area when you're done. And you want to leave the steri strips on as well. You can see there was very minimal bleeding. And she's still putting on some steri strips there, and then they'll put on a waterproof Band-Aid. So very simple, very easy, in a sense painless. And those pellets, again, last anywhere from 3 months to 6 months. And we can always check your levels if you're unsure. But patients barely know we're back there and we're talking about vacation, and then all of a sudden it's done. So patients are usually very, very satisfied with it. You'll be a little bit sore afterwards, but you'll be able to do all your activities. You won't be sitting on the area. We actually put it a little bit higher in the hip bone area. So you're not going to be having any problems with sitting. So that's it. That was the whole procedure right there. So hope that was helpful for you. And this is just kind of going over no scrubbing. You can ice if you're having trouble with pain. A little bit of ibuprofen is fine. Thank you. That was helpful.
see how we have all
to do it myself.
all these little tricks I'm learning. Okay, so we're going to answer a couple questions here also. And if you are interested in today's show notes, all you have to do is type in yes, and you will get them in your Facebook Messenger. So Mendy was nice enough to give us a whole document on the pellet therapy. A lot of questions are answered in the document. So it'll give you some notes on that. So let's go ahead and I know Tracy said here, I actually met with Mendy today and blood work was done, and the slides are wonderful that she shared. Thursday, we're gonna cut on Tracy on Thursday. All right.
I can't wait for you to feel better, Tracy.
I know, isn't it awesome? Kelly says, finding an MD is a struggle in my area. The PA said she could test, however, there's nothing she could do for me. Who would you recommend?
Yes. So BioTE, and so that's what the little logo looks like right there. And you want to go to biotmedical.com. And you can search for a provider in your area. And there are several, actually. I'm not sure, Kelly, what town you're in, but if you want to private message me, I would be happy to find you a reputable provider that can help you out. But there's several in the Bay Area, actually hundreds. So, but you want to definitely find somebody that uses reputable bioidentical hormones.
Yeah, I personally ended up, starting with someone over in the Las Vegas area, and not, as Mendy said, you want to find somebody reputable. And so I started, not really trusting this person, and ended up over here in the Bay Area, and then really ultimately ended up at the Tahoma Clinic, where Dr. Jonathan Wright, who is really the creator of the bioidentical protocol, he created the Tahoma Clinic. And I just work online remotely with a practitioner there. They send me their tests, they have their own labs, and that has worked really well for me. So there are remote options out there. And, I don't know, do you guys do any remote work, Mendy?
We don't travel to other clinics here. We're pretty much in the city, but there are several. Nebraska is pretty rural, and there are several providers, in the Grand Island area and in smaller, 10,000 people towns. So I'm sure that there are options. Mm-hmm.
Okay. So Suzanne says, if you have gained weight from the imbalance of hormones and begin therapy, how long before you should start to see a loss again?
Absolutely. Great question. So I actually have a graphic, and I'll be posting it to the page here. But typically, I do not like to advertise this as a weight loss method. Okay. But we do see decreases in waist circumference, and that can take up to 2 years. Okay. But you can see the weight loss pretty quickly within 6 months if there's an imbalance. You don't want to use this as a weight loss tool. Okay. If there's an imbalance, then of course it will help your weight. There is a little bit of water retention when you first start the pellets. And also you want to make sure that you get good pellets. So there's pellets that have estrogen, and there's pellets that have estrone. You don't want pellets that convert to estrone. That's E4. Okay. You want good quality pellets. You get what you pay for. So you want pellets or hormones that have E2. Okay, that is more closely associated with lower lipid levels and lower blood pressure levels. So there is a supplement that you can do, and you can do this now, called DIM to help with weight loss. DIM is what it's called. And I will put that on the site as well. And actually that handout talks about it. So if you feel like you're in imbalance, or you are getting hormones and you're not getting the right results, the DIM can be really helpful, and it prevents breast cancer too. So that's a great addition as well. So don't expect immediate weight loss from pellets. It's more of a gradual thing, right? It's just like weight loss. It's a slow progress. It's a marathon, not a sprint. If you've had an imbalance all of your life, sometimes that can be gone forever. So like I said, it works better if you still have hormones in your tissue. Remember that we carry around hormones in our tissue. That's why immediately after a hysterectomy, you're not going to automatically feel symptoms, right? Because you have those hormones in your tissue. So remember that and be patient with it.
Yeah, for sure. For me, when I started kind of like feeling that middle stuff come on, which I had never had, my weight was always, between my hips and my knees. But when I started feeling that come on, and I first went and got tested, and I first started using the BHRT, it actually took me probably 3 to 6 months before I really started to kind of feel things settle. And then about a year, I really started feeling like my old self again. So it does take a while. It's not, as Mendy said, it's not a weight loss. This is about really kind of turning back our clock and making ourselves feel like we felt energy wise, and just as females, maybe like 10 years ago. And like Mendy was saying, you get your libido back if that's been lacking, and you get your energy levels start to come up to where, you get out of bed and you feel like getting out of bed, and that's a
Mhm.
privilege, and of
Absolutely.
course, and their kids and our husbands and our bosses and whoever else, the PTA or whatever it is, that we're taking care of, and we put ourselves over in the back corner, and until we feel lost. And I think it's so important, the minute you start feeling off, exhausted, whatever, don't just chalk it up to stress, don't just chalk it up to all these different things, but actually go in, and if you can, see a functional medicine practitioner, see someone who's going to actually take care of your whole being. And that's just my opinion. Mendy's actually a practitioner. I'm not.
No,
But
I totally agree. And we may not, without those biometrics, realize what's going on, right? We didn't realize that our percentage of body fat was off. I'm of normal weight. My BMI has been normal my entire life, and but when I stepped on that scale 3-4 years ago, my percentage of body fat was out the roof. So you may not actually see a change. I get all the time, you look thinner, you look thinner. Thanks, I'm the same weight that I was, but my percentage of body fat is completely changed because of hormones. So, if that scale is not budging, trust the process that, even with ideal protein, that there's that pendulum shift between that percentage of body fat and the muscle. So you're definitely going to see it. It's proven time and time again in studies that, the hormones can definitely help with that muscle gain and fat loss. Mm-hmm.
yeah, and I love those words. Trust the process. One of the biggest things that we do is we, easily get bored, or we easily, we want instant results all the time. And our bodies we're science projects. So, you can't expect that something that you've kind of let go over years, or maybe we're just transitioning into a new phase of our life, that all of a sudden you get a cream or whatever it is, a pellet, and tomorrow you're gonna be amazing. So do trust the process, give it the 6 months to a year time frame that it takes, and like Mendy said, work with a practitioner that you really, really trust. So
Absolutely.
all right, so we have another, let's see here. This is a big one. It says, Cynthia says, I started the bioidentical hormones with a functional medicine MD who introduced me to IP 7 years ago. I've been with him ever since and do a 6-month check-in and once a year blood work. It has helped enormously, but it is expensive. Out-of-pocket compound meds, they can be expensive. And now I feel take these identical hormones for life. It's insurance is not always going to cover those things. And so kind of what her question is are these things really a lifer? Like, are we really going to be on bioidentical hormones for the rest of our lives?
Yeah, there's no absolute age, discontinuation. If it's something that you do want to go off, I would definitely talk to your doctor. There's definitely, options that will be a little bit less on the pocketbook. But when you look at it in the long run, if you can prevent a heart attack, prevent a stroke, prevent, diabetes, it's kind of like an inexpensive life insurance policy when you look at it that way. So the creams are going to cost about $50 to $60, and the bioidentical hormones through the pellet are going to be about anywhere from $70 to $120. So they are a little bit more. I have seen some creams that are as high as $200 a month. So, but that's a great question. If you do decide to go off of your hormones, I would definitely taper. The longer the taper, even a year of a taper, is really helpful. A lot of people taper over a couple weeks time. I would definitely recommend, if you decide to stop, to just taper off very, very slowly, and then it should be more of a natural, like a menopausal process. I'm a women of faith, and so I believe that God, caused menopause for some sort of reason. I don't know why, but so I never try and talk patients into hormones. Like I said, it's like a vitamin. Okay, if you don't absolutely need it, but if you take your vitamins and you take your supplements, you're going to feel better. So, don't let anybody ever guilt trip you into thinking that you have to have hormones, but they definitely help.
Yeah, it gives you a better quality of life. And that's why I really, really wanted to share this program today, because I know what a difference it has made for me in my late 40s and 50s. And it's interesting, my boyfriend and I were talking about that this weekend. He said, I think you look better today than you did 10 years
Aww.
ago. And
He's a
I mean, no, but we were both looking at pictures, and I said, I don't know. I think you're right.
Yeah.
I do think these therapies are able to, keep us in a good place.
Yeah. And I think if it's that important to you, you will find other ways to, mediate it. I tell people it's less than a cable bill, right? So, what is your cable doing for you, really? So that's something to think about, and most, health insurance plans have HSAs nowadays. So you can usually use your HSA plan to help pay. So if that's something you don't have and you're thinking about doing hormones or even ideal protein in a medical clinic, consider using your HSA for some of these things. I know that they allow Botox. Why wouldn't they allow hormones? So we do quite a few letters for patients to their HSA or their flex spending accounts to mitigate the cost.
That's awesome. I love that. Wow. Okay, everybody. So thank you so much for joining us today. And if you would like the show notes that Mendy has provided on the pellet therapy, all you have to do is type in the word yes. And thank you again. If you're watching us in the replay, would you please tell us where you're from and say hello? One more note, Karen Westerman said, if they improve your quality of life, the money is well spent. I use the HSA for compounded scripts. So thank you, Karen,
Hi,
for
Karen.
that. Yeah, Karen's going to be coming out to visit me in a couple of weeks. I'm really, really excited to get to spend some time. Yeah, you should get on that train and come too, Mendy.
I know. It's going to happen. I promise.
All right, everybody. Mendy, do you have a last few bit of words to say?
No, that's it. Just find somebody that you're comfortable with. I'm always available by email or messenger. Find me on Facebook. I'd be happy to help any way I can. But I wish everybody well.
Okay, so the two videos we didn't get to see because we didn't have sound, and they're actual people talking about their experience with the bioidentical hormones. I will put links to them in the comment section so you guys can watch them. And again, if you want the show notes, all you have to do is type in the word yes. And we will see you soon. Thank you for joining us. And please share our broadcast to let other people know about this. Bye-bye, everybody.
Bye-bye. Have a great day.